Hey everyone, Dr. Chaffee here. Just wanted to continue on with the women's health theme that I've been doing. I just did a video recently talking about fertility and how to optimize your health in order to conceive and have a healthy pregnancy, and also for men trying to optimize their chances of conception as well. Today I just wanted to talk about something called premenstrual dysphoric disorder, or PMDD. This is something I've had a few people ask me about, and so I want to go in a little bit about that. So this is something that's it's a more severe form of PMS. Usually happens around the same time, about a week or so prior to menstruation. It's not known exactly why this is, and therefore there aren't really any good treatments for it, as we'll talk about. But this is likely an abnormal reaction to the normal hormonal changes that we see with the cycle. It can also cause a reduction in serotonin. Serotonin is one of the chemicals in your brain that allows us to be happy, and this is why people take selective serotonin reuptake inhibitors, so that they increase the efficacy of the serotonin in their brain, which actually doesn't necessarily show that it actually does anything very beneficial, actually, now that we have more numbers out there, but that's for another time. Who's at risk of this? Well, people that have had themselves have PMS, or their family members have had PMS or PMDD. They would be at a higher risk for having that as well. People with a history of depression or postpartum depression or other mood disorders can also be at risk of this as well. This can be quite serious and quite a severe and debilitating issue that can leave people make it very difficult to live their normal life and to work their job, take care of themselves and their family, and has a number of different symptoms, such as irritability, being very nervous, feeling like they're out of control, agitation, being very angry, maybe unnecessarily or inappropriately to inappropriate situations, difficulty concentrating, depression, being very, very tired, severe fatigue, anxious, confusion, forgetfulness, having a poor self-image, and just feeling low in general. Even paranoia, emotional sensitivity, mood swings, crying spells, and insomnia. And then you can get physical manifestations of this. You can get a lot of bloating and swelling, or even respiratory issues like asthma, and even pain in your eyes, or maybe even some blurred vision. So there's a lot of things going on there, but obviously that can all add up to being a very miserable situation. How is this diagnosed? This is diagnosed over the course of a year. Sometimes people would have a journal that they would keep track of their symptoms with their cycle in relation to this. And the criteria for diagnosis is over the course of 1 year, with most of your cycles having 5 or more of those symptoms that we talked about. So, low mood, anger and irritability, reduced concentration, lack of interest in things you would normally be interested in, being moody, having increased appetite, insomnia, feeling overwhelmed, and those physical characteristics that we saw, and that these would disturb your normal everyday function of your social encounters, of your work, or anything else, and it's not related to something else, some other issue that's going on. This is not something that we have great treatments for, but according to Johns Hopkins University, the normal treatment would be changes in diet, like an increase in protein. They even say increase in carbohydrates, which obviously I would not agree with, and I'll tell you why. Reduction in sugar, reduction in caffeine, reduction in alcohol, all of which I would absolutely agree with. Increased exercise, try to reduce stress, taking vitamins, especially B vitamins like B6, non-steroidal anti-inflammatories to help with the physical soreness. That's another thing is you can get breast tenderness and headaches as well. So this can come with physical discomfort as well. And then possibly taking those SSRIs that we talked about, the selective serotonin reuptake inhibitors, which again, even for depressed patients, don't necessarily show as much benefit as we would hope. And taking birth control pills. Okay, so what is this all sort of lining up to? To me, when I look at that, you see a lot of issues that can be related to hormonal health and depression. And we're treating for depression with SSRIs and other sorts of things such as mood, stress and diet and exercise as well, and also addressing hormonal issues with the birth control pill, which can normalize our cycle because you're just getting this steady hit of hormones, and that can, if your hormones are a bit out of balance, maybe this can help rebalance them. As I talked about in the hormonal health and reproductive health episode, a lot of this stuff comes down to what you eat. It almost entirely comes down to what you eat. As I talked about in that video, there's things called PCOS, polycystic ovarian syndrome, which is a leading cause of infertility, and fibroids as well. These are things that people suffer with. Well, PCOS is now known to be caused by hyperinsulinemia, so too much insulin, right? So this is why I would disagree with Johns Hopkins about eating carbs, because I think that this can actually dysregulate your hormones and your hormonal health. And obviously, if we're dealing with a hormonal issue, that's not what you want to do. So in PCOS and any woman in general, insulin, when you have high insulin, this is going to block the enzyme that converts testosterone into estrogen, because we actually all make testosterone. It's just that women then convert that testosterone into estrogen in their ovaries. So that is how that gets converted. And so when you have high insulin, it blocks that conversion. So they have much too high testosterone and much too low estrogen. And obviously this is going to be very disruptive hormonally for a woman, and this is why PCOS is such a difficult condition to have. People generally put on a lot of weight, but also to do with high insulin levels and eating a lot of carbohydrates and likely sugar, and also this hormonal dysregulation, having too much testosterone. They start growing hair in areas that they normally wouldn't, so it's called hirsutism. So they might grow mustache and facial hair and get body hair or back hair, and this isn't nice for people that don't want hair there. So Hopkins, recognized reducing sugar, so that's going to be a good thing. And, I would just think that the carbohydrates, they were very close, but I think they missed it on that one. Also, we're treating what really sounds like, psychological or mood disorders, and people that have a history of depression and a history of mood disorders are going to have an increased risk of PMDD. Okay, well, what do we know about this? I did an episode with Natalie West, who's a clinical psychotherapist, and we went through all the different ways that diet can seriously affect not only your mood, not only depression, but actually psychiatric issues such as schizophrenia or OCD or bipolar disorder. These are very serious psychiatric issues, and and depression not being least among them, that can be absolutely reversed by putting people on a carnivore diet and getting rid of all of these different factors in carbohydrates and different things in vegetables and plants that cause these problems. And putting people on a ketogenic diet and especially a carnivore diet, you're getting people off their psychiatric medication, and they're not hearing voices anymore. They're not having visual auditory hallucinations anymore. That is major stuff. And so you have an issue like PMDD where you have hormones out of balance and you're having depression issues. Going on a carnivore diet is going to address both of those things. And I'm not saying that this is going to cure everything, because I don't know. There's no data on this. No one's ever done a test on this. I'm just looking at first principles on how our body works and how the carnivore diet works. It's going to reduce your insulin down to normal levels. You're going to be able to convert testosterone into estrogen. You're going to balance your hormones normally. You're going to remove the different factors that are going to derange your any sort of psychological issues and promote depression and to promote all these mood swings and anger outbursts as well. We also know from many studies that lower LDL cholesterol is actually implicated in depression, and cholesterol is also is the precursor to all of your hormones, to testosterone, estrogen, progestogens, cortisol, glucocorticoids, mineralocorticoids. All of your major hormones are all made from cholesterol. And so if we're on, say, a vegetarian diet or just a standard high carb, low fat American diet, Western diet, Australian diet, European diet, we are not going to get enough cholesterol and we are not going to make enough hormones, and that's going to further disrupt your hormonal health. We also have, like I said, these studies that look at low LDL cholesterol have higher rates of depression. And more importantly, people with low LDL cholesterol and depression have a much higher rate of suicidality. So that's very serious. This is actually causing a real problem with people, to the point that they feel that they can't take it anymore and they have to end their life. They're so unhealthy mentally, and that's very scary. So these are all linked to diet, and I've discussed that in other podcasts that you can look at the hormonal health and the fertility episode that I recently did, as well as the one with Natalie West, and we talk about how diet can seriously change your hormonal health, and then with Natalie West, how it can seriously help your mental health. And that's a combination of these two combined are really what it looks like to me, and from reading in the literature, what PMDD is. And you're having a combination of hormonal dysregulation as well as your mood and your psychological health disrupted as well. And both of those things are seriously affected by the things that we eat or don't eat. So you're eating things that aren't biologically appropriate, that our species wasn't designed to eat, like fruits, like vegetables, like roots, like mushrooms, okay? And you're not getting the proper human nutrition that we need: meat, fat, cholesterol. Cholesterol is so important. So these things are absolutely vital to our health. And I would be willing to bet that this is going to seriously help people suffering from PMDD or PMS if they really go pure and increase their meat, increase their cholesterol. They're going to optimize their hormonal health. They're going to optimize their mental health. And even if this doesn't do a lick for PMDD, it's going to seriously change the rest of your health, physically and mentally, and that is going to make you much better able to deal with the serious issue of PMDD, if not actually treat it directly, which I would be very surprised if it didn't. Okay, guys, I hope you found that helpful. That's the best I could do on that one, because this is something that we really don't know much about, and obviously we haven't done any studies on this with carnivore diet. But according to Hopkins, there are dietary changes that they do and they find helpful already. So that's sort of linked there. They already treat with SSRIs, so there's a depression component, and they treat with birth control pills, so there's a hormonal component. So addressing this by going on a carnivore diet, a high-fat carnivore diet, or at least a high-fat ketogenic diet, so that you normalize your insulin and your hormones will then become normalized from the cholesterol, from lack of hyperinsulinemia, you should see a significant improvement. I would be shocked if you didn't. All right, guys, please let me know if you found this helpful, and please let me know if you try this and it helps. Put it in the comments so that everyone can see what your experience with this is. Thank you very much. Hey guys, thank you very much for taking the time out to listen to what I had to say. If you like it, then please like and subscribe to my YouTube channel and podcast. And if you're on YouTube, then please hit that little bell and subscribe, and that'll let you know anytime I have a new video out, which should be every week, if not more. And if you could share this with your friends, that would help me get the word out and let me know that you like what I'm doing. Thanks again, guys.